Good day everyone, I am Dr. Kedar. I am a consultant pediatrician and allergist at Ankura hospitals in Hyderabad. Today I have compiled a list of common emergencies that parents usually encounter in the home. This information serves not only for the parents but also for other child care personnel like teachers etc. who care for children, be in their facility or be in their home, wherein this certain minute emergencies may bring about a lot of stressful situation, and I would tell you some tips how to get out of this. And knowing how to deal with these emergencies is really helpful on the part of the parents and child care personnel. Now let us delve deep into 10 common pediatric problems that usually parents or child caregivers encounter and how to deal with them most effectively before they reach the healthcare facility. Now, the very important aspect that we should understand here is children can't verbalize their symptoms. They can't explain their symptoms to the core. We as pediatricians have to completely rely on what the child care personnel, be it parents or teachers or guardians, tell us completely. So, sometimes I always remember my professor telling that pediatrics is equal to veterinary care, wherein the patients or maybe the subjects can't explain what symptoms exactly they are facing. And for this topic, the background, I have given a small talk regarding red flags in pediatric care in March 2025. I would urge everybody to have a look at that video which I have released in March 2025 to get an idea about what are the red flag signs in child care. Now, extension to that is 10 common pediatric emergencies encountered in the home and what parents have to take care as a first aid before reaching the healthcare facility. Now, very important thing as discussed in my earlier video in red flags, high grade fever of more than 104 degrees, unresponsive child, that child who is having seizures or fits, and persistent vomitings, persistent loose motions, diarrhea, respiratory distress, etc. have been termed as red flag signs. Now, parents, I always believe that parents are the best clinicians because what we encounter with our patients is only 2 to 3 minutes, but whereas the parents spend hours and days together with the children and henceforth they are better clinicians than us. We might treat a particular illness, but the duration, the progression of the disease is best judged by a parent. So as a pediatrician, I always advise everyone around me not to miscalculate the parents' symptoms that they tell us. Never ignore a parental concern is what is the mantra in my pediatric practice. Now we will see 10 important emergencies what usually children encounter and you as parents have to deal with them in the most effective way without getting panic. The first topic would be an acute attack of asthma. Now what is asthma? Asthma is nothing but it is narrowing of the airways because of constriction, narrowing and mucus accumulation in the lungs. This leads to improper oxygenation, improper air exchange, and this will manifest clinically as increased work of breathing, or in otherwise we call it as respiratory difficulty. So respiratory difficulty in asthma is a very unique thing wherein you can hear a wheezing sound. A wheezing or a whistling sound is heard when the child is taking inspiration expiration, and this is a case when you need to be alert. Now if a child is a known patient of asthma, you might already have known about his triggers, and immediately eliminating those triggers is of utmost importance. If that cannot be done, then get him to the healthcare facility as early as possible. If a particular patient is a known case of asthma, then your doctor might have already told you the emergency asthma action plan, wherein along with the long-term medication, what should be used in the event of an acute emergency will usually be explained by any pediatrician who deals with this scenario. In such a situation, you need to give that emergency medication as early as possible and get the child immediately to the healthcare facility. If it's a new episode, de novo episode or first episode, I urge the parents not to panic. Keep the child comfortable in an upright position and reach to the nearest hospital ASAP. This is the most important thing because we are trained to deal with that emergencies. We can initially evaluate and then treat the child. The second scenario what usually is encountered is choking. What is choking episode? Choking episode is getting something stuck in the throat or in the airway. This causes immediate respiratory difficulty. So usually this is caused by a foreign object. Sometimes we come across certain patients coming to us with accidental stucking of peanuts in the throat. Peanut is the most common thing that we usually see in our practice. Peanuts, then hazelnuts, cashew nuts. Nuts are the ones that are usually stuck inside the airway. As you know, the children's airways are quite small with a small neck. The gap between the foot pipe and the windpipe is very near in the throat. So whenever an object goes inside the throat and accidentally if it enters into the windpipe instead of foot pipe, it causes a choking episode. And our respiratory muscles are tuned in such a way that anything foreign object enters into the airway, immediately the airway becomes narrowed and constricted. So this particular problem causes acute respiratory difficulty, or in medical terms it is called as impending respiratory arrest. So impending respiratory arrest is an immediate medical emergency, and once if you notice that child is having a sudden difficulty in breathing for otherwise absolutely normal child, the child who is experiencing sudden acute onset of respiratory difficulty associated with gagging, then immediately get him to the hospital. And in the description box below, I would like to mention 2 videos wherein in infants where you can give chest thrust and back blows for something which you can deal for those children, for those parents who are trained, and older children giving a chest thrust in between the abdomen and the chest, pressing on the diaphragmatic muscles, is very essential to dislodge that foreign object. This dislodgement of foreign object gives the child a good relief. Sometimes he might even throw out the offending foreign object also. If unconscious, do not attempt these maneuvers and call 108 immediately. And my general advice to all the parents out there is to avoid giving small objects for playing or anything like that. Now, the third scenario, what we have dealt till now, the first is acute attack of asthma, second is choking. Third one that I am going to deal with is acute allergic reactions, or in medical terminology this is called as anaphylactic reactions. What are the most common causes of acute allergic reactions? So the very important thing what I have observed in my practice commonly is the first, shellfish. Shellfishes are known to cause lot of acute allergic reactions, followed by peanuts, ingestion of peanut. The third thing is insect stings, insect bites, and fourth is medicines. These are the common scenarios what I have usually encountered by causing acute allergic reactions. Now, how to classify these acute allergic reactions? They are classified as mild, moderate and severe. So for mild, usually the clinical symptoms include rashes, itching, lethargy, poor feeding, etc. For moderate, we usually come across swellings around the lips, swellings on the hands, feet, hives, painful swellings also, sometimes in the genital regions. But in severe cases, there is a cardiorespiratory failure. Difficulty in managing blood circulation and difficulty in breathing are the hallmark signs of a near fatal or a life-threatening anaphylactic reaction or an allergic reaction. In such a situation, please get the child immediately to the hospital. Don't try anything at home. The next scenario is a head injury. Very commonly seen, children usually run, play and hit or bump to a wall or fall from bed. Very common scenarios that we usually see is child falling from the bed. Now, whenever a child comes to the hospital with a complaint of falling from a bed or banging a head against a wall or a door or something like that, 2 things usually occur. It could be a mild, moderate or severe injury. In medical terminology, we classify any head injury as traumatic head injury and non-traumatic head injury. A non-traumatic head injury is the one, or sometimes in true terminology it is called as traumatic brain injury. So in a non-traumatic injury, usually what happens, usually we see patients not having any of the 4 classical danger signs. So what are the 4 classical danger signs? Head injury causes loss of consciousness, uncontrollable persistent vomitings, bleeding from the ear and nose, and finally seizures or fits, or in Hindi it is called as dore padna. So these are the symptoms that are usually seen in any patient with head injury. So classifying that traumatic head injury as mild, moderate and severe. So in mild and moderate, usual symptoms that are seen are headache, dizziness, confusion and nausea. In a severe traumatic brain injury, we see these 4 signs as I have told you earlier: loss of consciousness, vomitings, bleeding from the nose and ear, and finally fits. When these occur, please report to the nearest medical center for getting an access to a good medical care. Now, I was talking about the children who are playing and running around getting bumped to the head. But what about getting a fracture or a sprain? You hit with a cricket ball or a cricket bat or something like that, you have a fracture or a sprain. So how usually these children present and what are you supposed to do? Now, common injuries are the ones that are sports injuries in children, especially for those in school age children. They play a lot, run a lot, and classical injuries are always fractures or sprains. In these injuries, we usually see swelling of the affected part, bruising of the affected part, inability to move. These are the 3 most important things. Now, a decision whether a fracture is there or not there entirely depends upon the clinician's examination findings as well as X-ray if it is done. If we mandate that X-ray to be taken, we have to see for the X-ray and then decide whether fracture is there or not. Based upon that, we plan our treatment. Usually the treatment consists of rest of the affected limb, elevation of the affected limb, and ice pack. If at all we find that fracture is there, then immediately a pediatric orthopedic opinion is taken, followed by putting a cast for immobilization. So these are the characteristic things. But one thing I should tell here to all my patients out there is never apply a hard pressure or massage the area whenever you notice any injury, because that causes a lot of other complications too. Now, the next scenario we'll be progressing to is petroleum product ingestion. Have you ever thought of ingesting a petroleum product? Now, what are these petroleum products? Petroleum products can be turpentine, paint thinner, kerosene, or petrol itself. You know, you have a small can of kerosene in the home. Where do we usually keep it? Near the shoe rack or somewhere which is quite easily accessible to every member of the family. But at the same time, we forget that children can crawl, walk, and out of curiosity, they can just gulp in a sip. Later on, realizing that the taste and smell is bad, they might throw up. But these are the most dangerous things that I have seen in my entire medical career. Turpentine, thinner, kerosene accidental ingestion causes lot of problems, and these are one of the most common poisonings seen across the globe because of their easy accessibility. And one thing we should always remember, they are look-alike. Especially turpentine and paint thinner are look-alike to water, and they are stored in the same bottles as water bottles. So this is where the confusion arises. What actually happens? Try holding a little amount of petrol in your palm. What happens? It vaporizes, right? So this vapor contains the chemical fumes, and these chemical fumes cause what I call as chemical damage to the lung or chemical pneumonia of the lung. So this chemical pneumonitis is the most dangerous thing ever seen, and once we see it, it is really a very bad condition wherein the child quickly progresses to a condition called as ARDS or acute respiratory distress syndrome, where the child gets admitted to ICU and sometimes even can be on a mechanical ventilator too. One thing I would request here for all the parents as a precautionary measure: never induce vomiting in a petroleum poisoning, because once you induce vomiting forcefully, the liquid comes up to the throat again, and again there can be more injury to the lung because of the vaporization of the petroleum. Problem may become very severe if you induce vomitings. So golden points to remember is never keep all these petroleum products easily accessible to children. And the second thing is, whenever you notice that child accidentally ingests a little bit of petroleum product, never induce vomiting and get him to the hospital immediately. The next scenario is a very important and a very common scenario, even though it is not an emergency, but there is an element of panic in the parents. What is it? It is a fever associated fits, or otherwise called as febrile seizures. Now, what are these febrile seizures? Febrile seizures or fever associated fits are usually seen in high grade fevers. Sometimes high grade fevers can precipitate a seizure or a fit like activity. It is a short lived activity with a short course, usually less than 60 seconds, and self subsiding. Most commonly seen between 6 months to 6 years. What we usually do is only a conservative management, because fits arising out of fever is considered as the most safest variety without any long-term medical or neurological complication. Usually in the first 1 or 2 episodes, no investigations are required. But if it progresses to recurrent episodes, then we might go for certain investigations like MRI or EEG, etc., based upon the need of the hour. During episodes, what as parents you are supposed to do in the house? In the house, just turn the child sidewards, not lying flat, because sometimes what happens is, when during an episode of a fit, if the child is lying flat on bed, he or she might vomit, and that vomit material may accidentally go inside the airway, causing choking episode again. So one problem leads to another. So make the child lie down on sideways and don't panic. And if it is already a known patient of febrile seizures, you might be having a medicine called as midazolam nasal spray. So then just put 2 sprays in the left nostril and 2 sprays in the right nostril, wait for 30 seconds till the seizure episode aborts, and get the child immediately to the healthcare facility. The next scenario what I usually deal with is dehydration. A simple word, isn't it? Dehydration is not a big rocket science, but why will the dehydration occur? Now we are in summer. Summer causes heat stroke, heat exhaustion. Children play out in the sun, they play cricket, they play soccer, they do everything. So water evaporates from the body and water loss causes dehydration. So this fluid loss can either be in the form of visible fluid loss or invisible fluid loss. Visible fluid loss is seen in stomach infections like gastroenteritis, where the child is having profuse vomitings and diarrhea, but whereas invisible water loss is basically because of improper intake or playing out in the sun for long hours. What are usually seen? Drying of the mouth, decreased output, sunken eyes. These are the very characteristic findings. So now how do you judge as parents? My message for parents for this particular discussion on dehydration is, how do you judge dehydration in the home? I usually tell parents a simple tip that is called as 4, 6 and 8 hours. If the child is not passing urine for 4 hours, consider that as mild to moderate dehydration. If the child is not passing urine for 6 to 8 hours, consider that as severe dehydration and report to the hospital immediately, or make him drink plenty of liquids, especially WHO formula ORS, oral rehydrating solution, that will help relieve the dehydration. If still not passing urine, please seek medical advice immediately. So the next scenario I would like to talk about is already the same topic that I have mentioned in the red flags, which is called as sepsis or septicemia. What is sepsis or septicemia? This is a generalized infection in the blood. We sometimes come across a scenario wherein the child is having fever for more than 4 to 5 days, and we do some investigations to rule out the possible cause of the problem, and it is found that his certain levels in the blood like CRP, total WBC count and procalcitonin are increased. This is nothing but generalized infection in the bloodstream. We tend to explain them this way, but actually it is the bacterial load of the body. A test which is called as CRP or procalcitonin does not indicate the focus of infection, but only indicates the intensity and severity of the infection in the body, and that is what we treat. In the home, what you are supposed to do, any high grade fever lasting for more than 3 to 4 days, please seek medical attention immediately so that we can go for necessary investigations and try to prevent complication. One of the most important complication of sepsis is called a septic shock, wherein the bacterial load increases tremendously, causing lowering of the BP, lowering of the peripheral blood flow, and even oxygenation to the tissues. Next scenario is a very important scenario, which is called as drowning. You don't usually encounter drowning in the home, but of late there are some instances that we have encountered, near drowning instances in swimming pools, etc. But this is a very difficult scenario to explain and to deal with. Here, this particular situation of drowning is again classified into 2 types. What are they? Near drowning and drowning. So what is near drowning? Near drowning is wherein the child fell into the water, but there is no respiratory arrest. In those scenarios where there is a respiratory arrest, then it is called as drowning. In near drowning, child doesn't have respiratory arrest. What actually happens in these 2 scenarios? In these 2 scenarios, sometimes the water can go into the airway and enter into the lungs, causing pneumonia-like changes, because water contains a lot of bacteria and viruses, isn't it? Now here we can differentiate into two types of drowning. First is the freshwater drowning and murky water drowning. In freshwater drowning, it can be a bad scenario wherein the water enters into the lung and causes all the nasty changes like pneumonitis. But in murky waters, where the bacterial load is high, where the fecal count is high, it causes much more bad chemical pneumonitis and bacterial or viral pneumonitis that we can think of. These situations should be dealt properly in the hospital, admitted to the hospital or ICU, or proper respiratory and neurological care has to be instilled. Last but not the least is burns during Diwali. Whenever the child is playing around, hot water, lot of situations are there wherein burns can be encountered by the parents. Now, how to classify these burns? First degree, second degree and third degree based upon the extent of the skin damage. But as parents, what are you supposed to do? You're not supposed to grade, isn't it? What you're supposed to do is immediately cool that part of the body, apply a non-adhesive bandage which doesn't get stuck to that, and don't try to apply any ointments, and get the child immediately to the nearest medical care facility wherein we will assess the intensity and severity of the burn and thereby plan the treatment accordingly. So I hope for all my wonderful folks out there, this is quite informative. So anything which I have missed, you can please message me on my personal window so that I will add to the list next time and then get back to you. So all of you have a wonderful weekend, holiday, and please be careful and enjoy the best. Thank you.